Hello everyone, my name is Vignesh Veluraja and today I'll be presenting on the impact of US government health policies and healthcare access and business operations. This presentation focuses on how government policy decisions shape healthcare systems, influence patient access, and affect insurance operations. Government involvement determines the level of funding, affordability, and innovation with the healthcare industry. These policies also influence how providers and payers allocate resources and respond to financial pressures. In this presentation, I will summarize a recent article on healthcare policy and connect it to concepts discussed in our textbook to show how public policy directly impacts healthcare business practices. Article summary. The article I chose is titled US Millions Face Soaring Health Costs as Subsidies Expire, published by Human Rights Watch in November 2025. It reports that about 4.8 million Americans risk losing their health insurance if the Affordable Care Act subsidies are not renewed. This change could increase the uninsured population by roughly 21%, significantly affecting healthcare affordability and accessibility. The article explains how federal policy decisions such as altering subsidy coverage have direct effects on hospitals, insurers, and patients. Hospitals face growing financial strain from unpaid care, while insurers encounter greater risk and instability in premium rates. Overall, the article illustrates how one government decision can have far reaching consequences for both healthcare businesses and patients nationwide. Connection to healthcare business context. According to our textbook, government policy is one of the strongest structural forces shaping healthcare operations, financing, and innovation. The article connects directly to this concept by showing how federal decisions alter provider payment models, patient coverage levels, and business strategies. When subsidies expire, hospitals must modify their budgets and adapt to changes in patient demographics and insurance status. Similarly, insurers must adjust by redesigning benefit plans, controlling costs, and managing new market risks. This relationship between public policy and private management demonstrates the interdependence between the two sectors. From a business standpoint, this case underscores that successful healthcare organization must remain flexible and responsive to ongoing policy changes. Key implications for health providers and payers. For healthcare providers such as hospitals and physicians, an increase in uninsured patients often results in higher levels of uncompensated or charity care, reducing overall revenue. The financial strain can be especially difficult for smaller or rural hospitals that already operate on narrow margins. For insurers, the expiration of subsidies may reduce the insured population, create instability in premium pricing, and increase financial risk due to adverse selection. Both providers and payers must find strategies to adapt to these challenges. Hospitals may expand outpatient and telehealth services to improve access and reduce costs, while insurers may explore value-based care models to enhance efficiency. Together, these adjustments demonstrate how the healthcare industry adapts to government policy changes. Government's role and regulation. The government plays a crucial role in establishing the framework within which the healthcare system operates. Federal and state policies determine access, payment rules, transparency requirements, and quality standards for providers and payers. The article highlights how changes in government subsidy policies have immediate business and social consequences across the healthcare system. When funding or coverage decreases, hospitals must innovate to stay financially sustainable, often investing in new technologies or community-based programs. Government decisions also influence competition and innovation by regulating costs and ensuring patient protection. This demonstrates that healthcare policy, economics, and business operations are deeply intertwined in shaping healthcare outcomes. References and conclusion. This presentation is based on three key sources that provide insight into current US health policy trends. The first is the 2025 Human Rights Watch article, which highlights the real world consequences of subsidy expiration on patients and healthcare providers. The second is 2024 JAMA Health Forum article by Shen, which explores ongoing health policy challenges and reform opportunities. The third is 2025 White House Executive Order promoting transparency in healthcare pricing. Together, these references provide a well-rounded understanding of how government actions impact healthcare access, cost, and innovation. Thank you for your attention, and I welcome any questions or thoughts about this presentation.